So I'm not gonna repeat my title again. It's a guiding on endodontic using retreatment. And this tooth obviously has hypercementosis and chronic echo abscess and root canal obliteration. So in the middle, in the left tube is the guided endodontic design. So let me begin. So let's go through the general data. It's a 71 years old male with no systemic disease and present with a mild pain and mild swelling over right lower posterior tooth area, and receive 246 root canal treatment and metal crown at the local dental clinical over 30 years ago. So let's see the clinical finding and the radiographic finding. The sinus tract over buccal giva area obvious, and we do the GP tracing to the distal root area, and obvious there's inadequate root canal filling material, and the mesial root is rarely filled. And of course, the echo radiolucency and the hypercementosis was noted both in mesial and distal root. And the problem depth is within normal limits, no mobility. And the patient with mild palpation pain. So the diagnosis of the POP is the previous treated, and the echo is the chronic echo abscess and with hypercementosis in both roots. And the treatment plan will be after the discussion, we remove the crown and we do the non-surgical retreatment. And if the sinus tract didn't heal or the symptom persist, and maybe we will consider to do the echo surgery. So let's see the treatment timeline. It's 2021 February. We remove the crown first, and we begin the endodontic retreatment. And after we begin, we locate three root canal, but we're missing the medial-lingual root canal, and it's obliteration. So we decided to take a CBCT for evaluation. And after we see the CBCT, we do the guided endodontic planning. And we at the March we use the guide plates, 3D print guide plates to locate the medial-lingual canal. And at the April, we finish the root canal treatment and follow up and with the temporary crown. And after a few months, at the November, we see the echo region healed, and no symptom sign was noted, and we put a final crown on it. So let's see, this is the first step. We remove the crown, and we found out that we remove the coronal sealing material, which is amalgam and IRM, but we find the medial-lingual root canal obliteration. So we check the CBCT, and this one is the a simple concept of the guided endodontic, or you can refer it to any navigation system. So we have reality tubes and scalp bone, and we take CBCT and oral scan to take the tissue information into digital world. And in digital world, we do the digital design and 3D print guide. And we use the 3D print guide back to reality to treat the patient. So this is the left side. This is the original CBCT, and the right side is with after we design. The yellow line is the guide plate. The red line is the oral scan service, and the green point here is we in digital design we put the drill path in the root canal. So let me see through it again. Yeah, the yellow line is the guide plate. The red line is the service. And let's see the green circle here. So we can see this one is the mesiolingual canal until here. And very echoically, we can see the root canal. So let's see in starting. This one is mesiolingual canal, and the other sides. So we do this in implant software, This one is the 3D render of the 3D print guide and the oral scan service. And this is the view of the when we designed it. So I use the 3D slicer to do a 3D reconstruction, which is the tools here. You can see the irregularity of ridge surface of cemented hypercementosis. And the green cylinder here is the pathway we try to reach the apex. So we use the clear resin to do a 3D print guide, and we manufacture a metal sleeve for this long shank bird to fit in. Then this metal sleeve, the diameter is a little bit bigger than the shank here. So we choose a 0.5 millimeter bird. At the tip we use cutting, and in the shank we fit it into the metal sleeve. This is the software I use, and the 3D slicer is open source, and the blender is also open source. And we use this tool to do some modification to our guide plate and the 3D slicer for CBCT analyze. And in the middle, this one is implant planning software in Taiwan. But you can do this with any kind of implant planning software. So this is actually a clinical execution of the guide plate. Everyone seeing this, they will ask, did you dream pass direct through the apex? But no, we push 1 to 2 millimeter at a time, and we stop, and we irrigation, and we use the pass file to check. And after that, we check the pass, and we go more than 1 and 2 millimeter. So this is the microscope image before the guided plate, and this is after the guided plate. This is the midlingual root canal orifice. So after we find all the 4 canals, we remove all filling material. Sorry for the scratch here. And we use a rotary instrument to clean, and sodium hypochlorite clean, and the passive ultrasonic irrigation. And after that, we use collateral compaction technique to fill the tubes. And as you can see, there's more radial opacity here. And this is I put here, and you can check the more radial opacity. It's a 5 millimeter drilling pass here. Then we use the guided endodontics. So this is after we clean the tubes and do the root canal filling. Microscope image, and this is the root canal field just after the root canal field, and this is the 2-year follow-up. And as you can see, the radiolucency is almost all healed, not completely healed, I think, but it's almost healed. And of course, we put a new crown on it. And this is my presentation. And if you are interested in any of this, I have my YouTube channel. You can scan the QR code, and I have more than 10 cases of guided endodontic or dynamic navigation. And thank you.